So thank you for joining us today on the NIHR Global Health Research Training and Career Development Awards webinar. My name is Eleanor Welsh and I'm one of the programme managers here at the NIHR based in Leeds in the UK. And I manage the Global Health Research SPARC Award, which is one of the two awards that will be the main focus of today's webinar. So I'm joined today by my colleagues Petra Newbound and Beth Davis. Petra, Beth, can you please introduce yourselves?
Hello everyone, my name is Petra Newbound. I'm a programme manager in the Global Health team as well, and I am involved in the CADA scheme, which we'll be talking about today as well.
Hi, my name is Beth Davis. I'm a Senior Programme Officer in the Global Health NIHR Academy team, and I'm supporting on the CADA Award.
Perfect, thank you both. We're also delighted to be joined today by the co-chairs of the Global Health Research Training and Career Development Funding Committee. So it's Professors Camilla Figueiredo and Professor Sanjay. So if you'd both like to introduce yourselves as well, please.
Hello, good morning, everyone. My name is Camila Figueiredo, and I'm a professor here at Federal University of Bahia, Brazil. And I co-chair both CADA and SPARC committees along with Professor Hassan.
Thank you. I'm Professor Sanjay. I'm a Professor of Global Health Education and Research Training and Career Development at the Medical Research Council Unit in the Gambia. And I'm a professor at the London School of Hygiene and Tropical Medicine. So I'm co-chairing. I'm a co-chair for the panel review panel of the SPARC at the CADA with Professor Camilla. Thank you.
Perfect. Thank you both. So yeah, that's great. Here is an overview of what we'll be talking about today. Petra, if you could just move on the slide, please. Perfect. Yeah, so we're just going to start by giving you a little bit of background about NIHR Global Health Research and the Global Health Research portfolio. And then we'll talk a little bit more about the two research training awards that we offer. So the NIHR Global Health Research Short Placement Award for Research Collaboration scheme. So we'll refer to this as SPARC going forwards. And then also the NIHR Global Health Research Cohort Academic Development Award, which we'll refer to as CADA going forwards. And then we'll hear from our co-chairs about what makes a competitive SPARC and CADA application. And then after that, we'll have a Q&A session where we'll answer any questions that you have. Next slide, please. So just to give you a bit of background about the NIHR and the Global Health Research portfolio. So since the NIHR was established in 2006, it's been our mission to improve the health and wealth of the nation through research. And we deliver this mission through 6 core work streams. And one of these work streams is funding applied global health research and training to meet the needs of the poorest people in low and middle income countries. Next slide, please. So just to talk a little bit about then the Global Health Research Programmes. So our Global Health Research Programme, which is funded through Official Development Assistance, or ODA, was established in 2016, and it's grown significantly since then. The NIHR funds high-quality, policy-relevant, impactful, applied global health research and training, and funds work that strengthens research capacity in both the UK and low- and middle-income countries through mutual learning and knowledge exchange. So the Global Health Research Programme Awards should promote community engagement, involvement, and equitable equitable research partnerships. And the main aim of the work of the NIHR Academy is strengthening research capacity, specifically through personal awards and through the Global Health Research Training Programme. We do this through various methods, including supporting formal trainees, supporting more experienced team members, supporting early career researchers through mentorship, sharing learning between collaborators, creating a diverse research teams with ranges of skills, enhancing organisations' ability to secure funding and research funding, and plus a variety of other ways. So next slide, please. So specifically then, the Global Health Research Training Programme adds value and strengthens on the existing investment that the existing investment in academic research capacity provided through the Global Health Research Programmes. And we focus on academy members and training leads. So a training lead works with the NIHR Academy to network and develop the Global Health Research Training Programme, share good academic career development practice and learn from others, communicate opportunities to the NIHR Global Health Research Academy members. And Academy members are all those who are receiving funding from or being supported by an NIHR Global Health Research Programme to develop their academic career. So if we can, next slide, please. Perfect. So we're now going to move on to the main part of today's webinar. So I'm going to talk first about the Global Health Research SPARC Award, and then Petra and Beth will jump in about CADA. And then after that, we'll hear from Camilla and Asan, who'll talk about what makes a competitive application. Next slide, please. So this slide here covers information that's relevant for both awards. So both awards are open to researchers within the Global Health Research Programme. The SPARC Award is aimed at Academy members and the CADA Award is aimed at training leads. And it's open to all programmes that are still active from the 1st of January next year onwards. It's important that placements and activities are delivered and completed 2 months before the end of the overarching NIHR research programme contract. Next slide, please. And the next one. Perfect. So the Global Health Research SPARC Award. The aim of the scheme is really about investing in individuals and enhancing their research training experience and academic career development. The scheme provides opportunities for Academy members to apply for funding to design and undertake short bespoke placements within another part of NIHR to train in a specific skill, network, or collaborate with other relevant researchers and experts. The hope is that the award can be used to boost CVs and help individuals to advance to the next steps in their career. And this could be through developing a skill which is needed or working on parts of an application. So there is the individual development, but another aim of the award is also to increase understanding in what NIHR can offer and connect researchers within NIHR. Next slide, please. So what funding is available? So the awards are up to £10,000 and it can fund travel, accommodation and subsistence. It can also cover short training courses and workshops and various placement outputs as well. So costs which we don't cover include research costs, supervisory fees, open access costs and conference fees. So there's a lot of flexibility within the award in terms of the placement length, and this can be from 2 weeks to 6 months in length, and they don't all have to be taken in one go, so you can break the placements up as well. Next slide, please. So where can you go in your placement? There are lots of different parts of the NIHR where placements can be undertaken, and this is across the Global Health Research Programme and also the UK NIHR infrastructure. So we have developed collaboration guides which provide further details about all of the different projects and what they have to offer in terms of expertise and the facilities they have available. And we encourage applicants to use this guide to see what's available when reaching out to other projects to decide where they want to do their placements. Applicants should consider seeking placements in NIHR Global Health Research Programme with similar specialisms to the programme where they're already based or working. You could consider seeking a placement in a programme that offers research training experiences that are not currently available where you are based or working, and also seeking a placement within the UK NIHR infrastructure. So this is the NIHR that's not funded by ODA. Next slide, please. So what can you do as part of your placement? Well, that's really up to you. So we encourage that you speak to your supervisors and identify any training need gaps that you might want to develop as part of your career development and what you want to achieve as part of your placement. So I've included some activities here that have been done as part of previous awards, just to give you an idea of what we might expect to see in an application. But as I said, it's pretty much up to you as the applicant and your supervisors. Next slide, please. Yeah, so, and again here, just to give you some more ideas, here are some examples of outputs and impact of the awards. So these include developing writing skills, including abstracts, applications and publications, increasing networks and enhancing CV. So one of our awardees reported how it was really valuable for them to be able to advertise that they've received funding and have been responsible for the project conception, management, analysis and dissemination. So next slide, please. Thank you. So I don't have time to go into the full scheme eligibility criteria now, so I'm just going to focus on a few of the main points. All of this information and a lot more is available on the NIHR website, and we encourage you to read the funding opportunity, the web pages and the guidance notes for course-specific information. So in terms of SPARC eligibility criteria, it's for Global Health Academy members who are receiving funding from or being supported by a global health research programme to develop their academic career. You need to be undertaking formal training or being supported by the programme to apply for a formal award. You must remain registered or employed at your employing organisation, and this organisation must be listed as an official collaborating institution within your Global Health Research Programme's current collaboration agreement. And you also must have support from both your employing organisation and your placement host organisation. So I'll hand over now to Petra, who's going to just give you a bit more information on CADA.
Thank you very much, Eleanor. So I'll just talk now a little bit about the Cohort Academic Development Award, abbreviated to CADA. So the overall aim of the scheme is to enable GHR programme awards to address the academic career development needs that they've identified in the cohort of individuals that they're supporting, particularly with their research training, and particularly those based in LMICs. So the CADA awards funding or offers funding for a tailored programme of activities which will meet the academic training and career development needs of these cohorts of the Academy members within the awards. And with that in mind, all of the applications should be informed by an academic development training needs analysis that has been done based on the LMIC-based cohort that the programme supports. The scheme aims to foster cross-NIHR global health working and allows individuals to capitalise on the benefits of being part of something larger than their own research environments. The CADA is open to applications from training leads, directors, principal investigators, research profs or GAFs who already hold programme awards, so within the current programmes. And as Eleanor mentioned, there has to be a contract end date after the 31st of December. They have to continue beyond the 1st of January. In terms of co-applicants and collaborators, it is optional to have a co-applicant. However, being a co-applicant is an additional opportunity for development for an Academy member within the programme. The co-applicant will be expected to take an active role in the development of the application and contribute to the planning, implementation and evaluation of the activities conducted as part of the award. So really quite an opportunity to develop their career experience. You also have the option to add a collaborator. Now, this collaborator must be from a different Global Health Programme award. And again, they can be Academy member, training lead or programme lead, but they must take a working role in developing the application and again, contributing to the planning, implementation an evaluation of the activities conducted as part of the award. We would encourage any lead applicant partners to consider partnering with another programme award within their application, be it through a regional or thematic alignment. And we'd encourage them to sort of ensure that the benefit of the funding is felt more widely than an individual programme award. To this end, please, as training leads, if there, please engage with other programme awards and identify those that may have found similar needs within their cohorts. And a joint programme of activities would be an interesting application. I'll now hand over to Beth, who will talk through the funding, the types of activities and the duration for CADA.
Thanks, Petra. So you can apply for up to £30,000 of funding in the CADA award, and this should be used to develop a programme of activities which has been informed by the training needs assessment and should focus on strengthening the cohort's academic, career, research skills and development. You can request funding for training fees to cover travel, accommodation and subsistence if these are required. You can also request funding for expert speakers or facilitators, the cost of venue hire and any other reasonable cost to deliver the activities, such as internet connectivity and the printing of course material. In terms of ineligible costs, as with the SPARC, we would expect your programme award to cover research costs, supervision fees, open access and conference fees. Next slide, please. So each programme of activities will be unique in terms of location, duration, structure, and how it's delivered and the context. But the overall aim is to be a platform for learning and development for the cohort, as well as providing peer-to-peer support and collaboration opportunities, and thereby contributing to capacity strengthening of early career researchers. We encourage you to develop a bespoke experience and programme of activities based on the training needs assessment, but some examples of activities you could plan are below. So you could hold or attend workshops or training courses on skills to strengthen research capacity. You could establish peer-to-peer learning groups and networks, establish cross-programme mentoring and establish cross-programme journal clubs. This is by no means an exhaustive list. It depends on your training needs assessment and the solutions that you feel would work best to address the gap. NIHR Global Health Programme training leads may identify training needs in order to perform their training lead role, and they may plan with other programme training leads in the Global Health Programmes to conduct activities to meet these needs. We hope you'd use this award to strengthen networks with the potential for longer-term sustainability, and the activities should stimulate longer-term links and networks, as well as contribute to personal and professional development of the global health research cohort. It's expected that the scheme will contribute to enhancing the NIHR Global Health Programme outcomes in achieving direct and primary benefit for patients and populations in low and middle income countries. Next slide, please. So in terms of duration, and there's no set minimum and maximum duration for the programme of activities because we recognise the need to adopt a flexible approach to this. Implementation of activities may range from 1 to 2 weeks up to 6 months and can be broken up to allow flexibility. Activities must start on the first day of the month between the 1st of August this year and the 1st of February next year, and must be completed before the 28th of February next year and at least 2 months before the end of the overarching Global Health Programme research contract in which the applicant is based, whichever comes first. Thanks, Petra.
Thanks, Beth. Just moving on. So in terms of outputs, as Beth alluded to, we're looking for you to consider how you any potential longer term benefits that could arise and what actions you might plan to take to ensure that any potential impact is realised. Please do describe tangible outputs within the section in the application form, and as Beth mentioned, what actions you're going to take to realise those. And it is expected that the scheme will contribute to enhancing the overall outcomes of the programme awards in achieving direct and primary benefit for patients and populations in LMICs. From a logistical perspective, similarly, we will be expecting a written report within 2 months of completion of the activities or by the 30th of April, whichever is soonest. Just going to cover very quickly a couple of points about the finance and the ODA, which is applicable in general to both awards, both SPARC and CADA. So with regards to the finance and the budgeting for both awards, for both SPARC and CADA, the contracting organisation will be the host organisation for the overarching Global Health Programme Award. If you're employed by another organisation, there needs to be a collaborating agreement in place between the host organisation for the overarching award and your employing organisation. Given that we're going to be contracting with the lead organisation, please do seek advice and input from the lead institution's finance and accounts department and gain their approval of any costings being proposed. Please do base any agreed rates for travel and subsistence or expenses on the lead institution's policy. And we're looking for costs requested to represent value for money. Just to quickly highlight that the new award system will ask for headline figures against each spending category rather than a detailed breakdown. However, should an application be successful, then we will be looking to confirm the detail behind the costing. So please ensure that your finances are based on a detailed breakdown, which can then be evidence if you're successful. There is a justification section, so please do use the narrative to support your request for overall costs and justify your value for money. The NIHR Global Health Research Schemes are funded by the Official Development Assistance Funding, ODA funding, and as such, an individual or anyone applying for this award must be able to demonstrate how the award will directly and primarily benefit patients and public in countries of the Organisation for Economic Cooperation and Development's Development Assistance Committee list of ODA recipients. So please, when you're looking to outline your application meets the ODA compliance points, please do consider outlining why it's a priority for your chosen country or countries. Please include some data and why this might provide some benefit in the future. So I'm now going to hand over to Camilla to go through an introduction to the committee, and I'll leave you there, Camilla.
Thank you, Greta. Yeah, our aim here today is basically to share some insights and suggestions around how to prepare good and strong applications for CADA and SPARC. Next slide, please. So before you get started, I just want to give you an overview about the composition of our funding committee. The committee is basically composed by a panel of global health and care professionals who provide sound and unbiased decision-making on application after carefully review and assess applications and provide recommendations on which application should be funded. Membership includes 2 co-chairs and members from different NIHR Global Health Research Programs, including Academy members. So now I pass over to Hassan, who will talk a little bit about SPARC, and then I will get back to talk about CADA. Thank you.
Thank you very much, Camilla. I will take you through to what really SPARC, what the panel will be looking for, specifically in a SPARC, that is placement applications. And next slide. Yeah, the common characteristics of good SPARC application is that it has to be very beneficial and impactful placement, and which will give you or make you attain new skills or experiences from a supportive environment. And as Eleanor alluded to, it's basically to support early career researchers who are actively pursuing academic research career. And they could be working in, various areas of global health research, either methodology or clinically oriented disciplines. Next slide. So, I think there is another one before this. There should be the applicant experience before this. This is the first slide. After that. Yeah. So there are 4 areas I would like you to consider that the panel will be looking for by and large. And one area is the applicant experience. The other one would be the placement plan and the benefits and impact of placements, as well as the institutional support, that is the host as well as your original institution. So for the experience, it is important. You should ask the question: how does your research experience and career to date make you suitable for such an award? And so you should be. You should be able to include research experience, the area of research interest, and the research methods you have, and also try to show the research projects that you have led or made a significant contribution to, making clear what your role was. And also, indicate whether you were involved in any relevant audit, evaluation, policy, community engagement experience. The other question that you need to ask yourself when writing or applying, why is this important? That is the rationale. Why is it important to undertake this placement at this particular point in your academic career? Because that's what we will be looking for as well, and what impact will this placement have? We'll elaborate more on this in your placement plan or in the benefits. So the next slide is about your placement plan. Next slide, please. Yeah. The placement plan, you should consider the gaps in your knowledge or skill set that this placement will be able to address. And how will your proposal placement plan meet these needs? Why have you chosen the particular placement host institution? Because that's also very important. You just don't choose any institution that wouldn't offer you the real the skill or the right environment for you to upskill yourself. Or is the placement providing training not currently available to you? You have to justify that this is really not available, and the placement, the host institution is the right place for you to attain this skill. And you should be able to elaborate the intended outcomes that will be achievable in the time frame that you are on this placement here. And importantly, try to measure. Don't make it too vague. Try to measure outcomes and indicators of success for this placement. So the next one should be the benefits you should consider. Next slide, please. Yeah. So the benefits and impact of the placement is also important to consider. Provide a high-quality research training experience. That's what the placement should do. And it should enhance your current research studies. It should shape meaningful collaboration partnerships with other NIHR GHR programs or any UK NIHR infrastructure. So in that regard, then you need to consider how will it support your development in global health research? And how does it meet and complement your unique training and career development needs? What will success look like from a personal perspective, and why now? Why do you have to do this placement now? How it will enhance your chances of achieving your career goals and ambition. Next slide. And apart from these benefits and impact, we need you to really submit 2 letters of support from your placement host institution supervisor and from your NIHR GHR training lead. And they should evidence why the supervisor host institution has been chosen, the support and commitment that they would give, that is both the institution and the supervisor, and how the ODA and safeguarding requirements will be met. So you should also consider your eligibility and suitability for the award, and so they should write that, in their support letter. You will be supported how they will support you to complete the placement, training, and plan activities. And then they should evidence your potential, your career trajectory. That's important, your career trajectory, because this is for early and mid-career, researchers, and the committee would like to see how your career trajectory and your commitment to enhancing your research career would look like, including how the opportunity will complement the research training or career development award you are currently undertaking. I think that's the last slide so I'll hand over to Pamela for the CADA one. So in summary, remember the applicant's experience is important, the placement plan is important, and benefits of an impact of the placement as well as the support letters. Thank you.
Yeah, thank you, Hassan. Yeah, and now CADA call actually, while SPARC is an individual award, CADA is designed to support the training and development of needs of a cohort. So it's really important to highlight that this application should be submitted by a training lead or direction of the problem or equivalent. So next slide, please. So what makes a strong CADA application? As I told you, CADA is about collective development. So strong application clearly identify the needs of the cohort and propose careful design and consider the activities that will add value to the cohort development needs. So you can think about, training, mentoring, other experience that you could propose in order to meet those needs of the cohort. So we strongly recommend you to actually apply and verify an assessment to identify those needs of each cohort. So applicants should demonstrate how in this application is different from what is already covered by NIHR Global Health Research Core funding. So you have to say to the committee, what's different from what is already funded. Applicants needs also to clearly show what extra value this brings to the cohort and how it has been carefully planned. Okay. Next slide, please. In terms of applicant experience, in this section, you should provide more information about the experience of applicant, co-applicant, and collaborator if you have one. It's important to highlight that collaborators should be from different NIHR Global Health NIHR group program, right? So it's really important to outline in the application how they will contribute to the program of activities that has been proposed. Also, applicants should clearly describe the experience in supporting career development, especially early career researchers, as well as, mention the experience of the applicant into the collaborator. The inclusion of early career research as a co-applicant, I think, is a very good idea, since this is an opportunity for them to gain additional experience in planning, delivering, and evaluating activities, and the involvement in the program of activity should be really well outlined. Next slide, please. So in terms of activities planned, the selection committee encouraged that applicants should dedicate sufficient time to develop a good application. Each activity should respond clearly, identify development need of the cohort. And also, applicants should clearly present a justification for the length of each proposed activity and how is the plan to achieve in certain time frame the activities that are included in the program, right? Including measurable outcomes that you allow you to measure the success of each activity. The cross-interaction between NIHR Global Health Research groups is really stimulated. So if you were able to, different groups could actually identify common needs of their cohorts. It's a very good idea to put together a joint application maybe aligned by a regional or thematic way or manner. Next slide, please. In terms of benefits and impact, the selection committee is really looking for applicants to clearly and concisely articulate the benefits and the impact of each activity will have on the cohort, and how the activities will provide a high quality and stimulate academic career development opportunity to meet actually the identified career development needs. Evaluation here, evaluation of the impact is essential. So applicants should really demonstrate the impact of the proposed activity to the cohort development using clear and measurable outcomes. I think that's all. I don't know if Asan would like to add something on CADA, but if not, over to you. Thank you.
That's fine, Camilla. Thanks.
Thank you, Asan.
Thank you very much. So just going to go through a few slides on useful information before we take questions. In terms of the application process, both SPARC and CADA are now on the new NIHR Awards Management System. Hopefully there'll be a link in the chat. Please do go and set up your account. Each signatory, co-applicant, collaborator named will have to have their own account to enable sign-off. All parties must confirm before the submission deadline. Talking of submission deadlines, I have the dates for both SPARC and CADA. Both competitions launched in February, and both SPARC and CADA close on the 14th of April at 1 p.m. British Summer Time. For both awards, there'll be eligibility and remit checking in May, and then we have the funding committee in June. And then again, as defined by the previous slides, the activities placements need to be completed by the end of February next year and can start from the 1st of August. There are a couple of slides of useful links. Put the links in the chat, but these relate directly to the SPARC and CADA funding opportunities, and also the placement and collaboration guide that we've alluded to previously. And again, there are some useful links just generally in terms of keeping in touch with the global health activities, with the academy activities, and any research capacity things that you may wish to get involved in, such as the GH Research Community Platform on NIHR Learn, which also has a number of training e-learning modules as well. If you have any questions at all and want to reach out directly, please email us on ghrtp@nihr.ac.uk. With that, I will say thank you very much and close the presentation and open to questions.
Great. Thanks, Petra. So yeah, we've got a few questions in the Q&A if we start and make our way through those. As we said before, if you see any questions that you like, please do upvote them so we can answer the most relevant questions. So the first question then that we have is, are the NIHR awards only for researchers, or can administrative and finance staff benefit too? So these awards are primarily based for Academy members. And as we said before, these are individuals who are being funded or supported to develop their academic research career. So in answer to the question, if the finance and admin staff are being supported to develop their academic career, then yes, they would be eligible. So for SPARC, you would probably need to demonstrate how the placement that you're proposing can be used to develop your academic career. And I'd say, but Petra, please correct me if I'm wrong, that for CADA, those individuals would be welcome to join activities if it is beneficial for them to join the proposed programme. Okay. Camilla, Hassan, do you have anything you wanted to add there?
Yeah,
that's fine by me.
Yeah, I think that's what you have mentioned. Actually, the activities should be delivered for a cohort, but other associates could also join and contribute to the research capacity to that local.
Great. Thank you. So then the next question we have is, do we need to have already prepared a proposal at the time of application for SPARC, or can we do it later on after being selected and through networking? So we would say that you should already have an idea in mind about your training needs and your career development needs. And when you reach out to programs and projects that you're interested in, you can ask these to see if they would be available to support you. And you should work then with the proposed placement supervisors to really develop the placement plan and shape your application. So then at the point of application, you do have quite a solid plan as to what you want to do on your placement. Any other comments on that? No? Cool. Great. So then the next one is there a structured communication system to facilitate connection with the host institution, or is the applicant expected to make individual arrangements? So in terms of what the NIHR provides, we have the placement and collaboration guide. So you can use this to explore all the different programs that we have available, and then you can look further into the institutions as well. But we would also say to really make use of your networks that you currently have, so your current supervisors and the people within your program, to see if they can link you up with other people as well. Any other thoughts on that? Great. So the next one is, I'm looking at knowledge exchange, dissemination and impact. Would I be eligible for SPARC? Camilla, Asan, I don't know if you want to jump in with the type of things you're looking for.
Yes,
So can you repeat? Sorry, Asan, go ahead.
Yeah, the knowledge and exchange is very important, so long as it's really related to your research program, and that's what you need to justify.
Perfect. Thank you. So the next one as well is, can a short collaborative sub-study be undertaken as part of a SPARC? So I think for us, we would say, yes, we have seen some individuals do part of their studies as part of the placement, but just to clarify that the award cannot fund research costs. So we wouldn't be able to fund any parts of this sub-study. And we'd also would like to see within the placement what you're doing to develop your research skills as well, not just doing undertaking a study. So yes, you can do it, but we wouldn't expect that to be the only thing that you have in your application. Would you agree, Camilla?
Yeah, that's exactly what
I think this SPARC is more a career development. So you have to aim to, learn something or interact with people, with different groups, and try to, achieve that. Instead, actually, it's not a opportunity to money for bench work or something like that.
Yeah. So one has to just be careful that this, the placement here is not equivalent to an internship. It's more or less like a upskilling for your career development. You need to justify how that placement will really improve your career development and help your career trajectory.
Right. Thank you. So the next one then is, I think this was in 2 parts, just 1 second. So they asked, can we join an already live program and learn through it? So for example, if a program is already happening in the UK on community engagement involvement and they get a SPARC award, do we need to make their own proposal, or can you join an already going on study to enhance the capacity? Any thoughts on this, Camilla or Asan, or I can jump in?
I think it would be great to have an own application, but you can mention that is linked to our ongoing program. I would suggest something like that. I don't know, Asan.
Yeah, I think there has to be some clarity. There's supposed to be some clarity here. This part is very individual based, but it's not far removed from what you're currently doing as a developing researcher. So, because the idea of the SPARC is really how does this help and complement your aim to really propel yourself or develop yourself or be in the trajectory pathway of development in your research. So it should be within the ambit of your own research, and you should justify why this, upskilling within, in the placement can really, either complement or help the research that you are doing that will eventually make you more, competitive as a researcher. So this is the idea.
Great. Thank you both. So then the next one is, can we apply for a 15 credit hour course for SPARC? So I think the answer would be yes, you can propose any training and development or courses as long as they meet your training needs and that they're also within the allocated budget. So the whole award needs to be within £10,000. So you'd also need to factor in any travel, accommodation, things like that, as well as the course fees. Any other comments there? Right. So the next question then is, can a programme apply for both SPARC and CADA? And what about multiple applicants for SPARC from a single group? Is this discouraged? So yes, programmes can apply for both SPARC and CADA, and they can also have multiple applicants apply for a SPARC as well. So we would just say, obviously, that the individuals applying for the CADA would obviously be different to the individuals applying for the SPARC. And yeah, any other thoughts then that you want to add, Camilla, Hassan, Petra?
I would just say that is great opportunities. So go for it. Yeah, SPARC and CADA. Yeah, great opportunities.
Thank you. And is it possible for one applicant to have 2 host supervisors from the same university for the same SPARC programme? So yes, we have seen people that have visited multiple different mentors and supervisors within the same university, or potentially even within different universities as well. But in terms of what is required from the application form, you would only need to have one main supervisor who will provide a letter of support. But equally, they could put on that letter that support will also be provided from these other individuals as well. Any other thoughts? No. Great. Okay, so the next one then is, could you please explain further what is meant by funded or supported? Yes, so in terms of, I assume you mean in terms of the Academy member definition. So someone who is funded by a global health research program would mean that either all or part of their time or salary is funded through the program. but we appreciate that there are also people that are working within these programs that are not necessarily funded through the program itself, but might be supported by individuals on the project, either through mentorship or various supervision and things like that. So just to make sure that this opportunity is available to as many people as possible, we expand this the definition of an Academy member to include funded or supported. But if you do have any specific questions about eligibility in terms of things like this, please do reach out to us via our email, which is ghrtp@nihr.ac.uk, and we'll be able to just provide further clarification and advice about that. Cool. Yes, so similarly, I guess then the next question, we have 2 PhD students within our programme who have received PhD funding that has been leveraged via the NIHR Global Health grant. Can we regard them as Academy members too? Yes, they would be seen as Academy members. Yeah. So we've got as a KEDI person, KEDI, would a placement require some sort of output at the end of the programme? So I'm not 100% sure what a KEDI person is, but we don't require specific outputs at the end of the programme, but we would sort of want you to show in the aims and objectives. We would want you to show that you've met the aims and objectives at the end of your placement. Would you agree, Camilla, Asan, anything you want to add here?
Yes, that's important, because when you outline your objectives, all what we would like to know, how are you going to meet this set of objectives in the placement? And then perhaps you should, at the end of the placement, of course, we expect a report, or the NIHR office will expect a report, and you should outline really the achievements of those objectives. But it's it's very, very important that during outlining your objectives, you should, delineate how each of those objectives are going to be met during the placement period.
Perfect. Thank you. And yeah, they've just clarified that KEDI is knowledge exchange, dissemination, and impact as well. Thank you. So then we've got one question here. So how many students will be awarded a SPARC, and is this per programme or internationally? So we don't have any limits in terms of per programme, or where it would just depend on the budget that is available for the whole awards, and this will be done based on the how the committee rank and review the applications. So there's no limit in terms of per programme or per country or things like that. Any other thoughts or questions there? Great. Well, it looks like we haven't got any more questions in the Q&A. I don't know if I've missed anywhere else. Petra, Beth, have you seen any others?
Yeah, there's just one question that was posted in the chat about the application form seeming different from last year, and could we please guide them to how to include their proposal and how to find relevant training courses in the UK that are available between September and December?
Yes, so it is slightly different to last year, as we've moved on to a new award management system. So this year, you'll put some basic information within the main part of the application, so things like your organisation, bit more details about you, and also you'll be asked to put the budget in here. There'll be then an upload section where for SPARC we'll ask you to upload a narrative CV for which there is templates available. You'll also need to upload your placement plan and the 2 letters of support, and all the information of what is required within the upload is available on our website, and we can share these links to the specific pages with this information of what needs to be included within the upload. We can share that with you. Petra, do you want to talk about this CADA?
Yeah, that's fine. It's very similar to the SPARC. Again, it's the sort of very high level information within the main body of the application, and then we have the flexible upload where you will put the majority of your plans, and again we want the training needs analysis or assessment uploaded as well, with some uploads of signatories. I suppose I would say if you have any discrete problems about a particular application, please do reach out either through the system itself in terms of a help ticket or using our email address GHRTP, and we can guide you through any specific queries you might have with your application.
Perfect. Thank you, Petra. And then just to answer the second part of that, which I think was about finding relevant training courses within the UK. We would just say, so just to have a look at our placement and collaboration guide, which can give you information about all the different programs. And then once you look into the programs, and you can see what organizations are part of that, and then you'll be able to look specifically on the organization's website to help you find some of these courses that are available. So we don't have anything in particular in the NIHR which has a list of all the different courses, so we just would advise just to sort of go and have a look and explore all the options that you can see online, and also talk to supervisors, mentors, people within your programs, as I'm sure they'll all be aware of various other workshops, training courses and things that are taking place. Yeah, any other thoughts, comments?
Yeah, most of the programs, NIHR programs, normally in their capacity building, they've got the need assessment, capacity building need assessment for people who are actually working within their programs already. So it's important to consult your program leads and academic leads, as well as the PIs of the programs that you are associated with, to really identify, the capacity need that you have listed or agreed with them, and that will be especially for the SPARC, and they will be able to advise you where to get the skills or how do you go about to really look for getting the placement, appropriate placement, because it's important to get the appropriate placement, because you need to justify that.
That's great. Thank you. I am conscious that we have come to the end of the hour, but I can just see that there are 2 more questions, which hopefully should be fairly quick to answer. So I'll just quickly answer them now, and then we can wrap up. So the first one is then, is there an interview associated with this process? The answer is no. We just have, you submit your application, which will be reviewed by a committee, and then we will let you know the outcome of this sort of towards the end of June, July time. And then the next one is, how and where can we find the network of institutions that are in the NIHR network? So if you can look in the webinar chat, there's a link to the placement and collaboration guide, and this gives a list of all the program awards that we have, and then you can use this to use the reference numbers to go on to the funding and awards page on NIHR to search for the specific programs, and that can give you a lot more detail about each of the programs. And also where we have there are also links to the program awards web pages as well, which we'll provide all the different information about the institutions too. Okay, so if that is everything, we can leave it there. I'd just like to say thank you all so much for joining us today. We hope that's been helpful and given you a bit more information about SPARC and CADA. But if you do have any questions, please do feel free to reach out to us and we'll be more than happy to help. And then, yeah, just to say as well, a big thanks to Camilla and Asan for joining us today and sharing their thoughts and advice on how to make a competitive application. So yeah, thanks everybody. Yeah, hope to see you soon.
Thank you.